Again, thank you for joining the Aahpo Town Hall. It's really a pleasure to be with all of you and a pleasure to provide evidence-based facts that we can all make decisions for us and our communities. And I really want to thank Diaspora, who's really been out there in the community and helping educate his fellow clergy as well. Thank you for joining us again. We're going to have two speakers this evening. We're going to have Dr. George Melikian, who has spoken in the past. George is an infectious disease specialist who will answer some of our COVID questions regarding adults. He's recently come back from Armenia, as well as Zareh Sananyan, who is the High Commissioner for the Diaspora. So where do we stand with COVID? Well, right now, globally, we are concerned about the 2020 Summer Olympics in Tokyo. They're really being threatened. The public in Japan, or 80% of the public, are against having it. For obvious reasons, they expect tens of thousands of people, athletes and their teams and entourages to come into the country. And the question is, how can they be safe in a isolated environment and then have people coming in and out to service them? So there's really a lot of concern, and there's questions really whether the government of Japan can safely hold the Olympics and follow all the international COVID standards. We've heard a lot about India. India has, unfortunately, a sad world record of over 400,000 cases of COVID in one day. Over 3,200 people are dying. One of the questions I have about the COVID response there is the international response, and what can we as Armenians learn from this? We know in Armenia we had issues with oxygen supply and other key medical supplies. And here we see a different world response with the US airlifting 3 plane loads of emergency supplies to India. So I guess the question is, what can we learn as a country to help Armenia in a situation should a problem like that arise? Moderna is really incredible. Not only has it produced the vaccine, it's upped its manufacturing capacity and is slated to produce over 1 billion doses of the vaccine this year and 3 billion in 2022. COVAX, that's the international agency, part of the World Health Organization, that's purchasing vaccine for the countries, the member countries, including Armenia, has now contracted to buy 500 million doses of the Moderna vaccine, 34 million of which will be delivered this year. Right now, Armenia is getting the AstraZeneca vaccine through COVAX. Interestingly, and I guess in retrospect, we could have anticipated this, we're seeing a lot of fake counterfeit COVID-19 health certificates, typically on international airlines. And I think this is going to be a problem as we move forward. We hear about fake vaccines being sent, and now fake vaccine certificates and COVID-19 testing certificates. Cruise ships, for those of us that like cruises, I think the Armenian Heritage Cruise will be sailing again. And the CDC has issued guidance to allow these ships to depart in mid-July. The guidance is 98% of the crew and 95% of the passengers need to be vaccinated. For those adventurous travelers amongst us also, the European Union is developing a COVID-19 pass that will allow travelers to travel anywhere within their 27 member nation states. And in the United States, a sign that things are changing. Hotel rates are going up, and we're seeing more in-store purchases at grocery stores. So now that we are getting so many of us are getting vaccinated in the United States, and more people are coming to the office, more people are shopping, more people are traveling, is the pandemic over? And an interesting statistic, which I can't see this because I'm blocked here, let me narrow this down, is that when we first started almost a year ago, over a year ago now, to get to 1 million cases took 90 days. To get to 10 million cases worldwide took 177 days, and 25 million cases, it took 240 days. Over the last 35 days, we now picked up another 25 million cases. So there's over 155 million cases in the world today. And we see the numbers going up as time goes on. How do we compare in the United States versus Armenia? Well, in the United States, we had a horrible winter. We had over close to 5,000 people dying per day. The death rate is now around 650 per day. And the infectious rate is coming down quite a bit as well. We're averaging about 50,000 patients, people in America coming down with COVID per day. In Armenia, the case averages is fortunately coming down. The system was previously strained, and we'll hear from our friend Dr. Melikian, who just returned from Armenia, how it is there. But the average case is about 527 new cases per day, and unfortunately 17 deaths per day in Armenia. I'm going to introduce the High Commissioner for the Diaspora, Zara Sananyan, is with us. We've admired him from a distance, and many of us have gotten to meet him on his tour of the United States. We commend him for his efforts to come out and press the flesh and hear the issues that we're having as individuals, as organizations, in trying to help our homeland. He has a very unique background. He was born in Yerevan, and around the age of 15, he came with his family to Los Angeles, where he attended a local high school. Went on to graduate from UCLA with a degree in history and political science. He then went on to a law degree at the University of Southern California. He dabbled a little bit in politics, volunteered on some committee work in Glendale, and ultimately succeeded to become a two-term mayor of Glendale. He's married with one daughter and three sons. Congratulations on your appointment to High Commissioner back in June of 2019. We very much enjoyed hearing about how you have your approach to government, your enthusiasm, and your desire to help Armenia and help the diaspora help Armenia. So thank you so much for joining us. And if you don't mind, let's move on.
Thank you, Larry. Thank you for that kind introduction. And I want to once again greet all of our fellow compatriots in the United States. I listened to most of your presentation, and it was very detailed and very comprehensive. So I think it gives a good overview of what the post-COVID, I guess I can't call it post-COVID, like the COVID situation is today. And as you mentioned, indeed, Armenia at this point has, Armenians at this point, those that reside in Armenia have to make a choice. Either they get vaccinated and continue to have this lifestyle that in essence pretends that there's no COVID anywhere, because folks have stopped wearing their masks, and the cafes and the restaurants are open because of the spring season. Everyone's out on the streets, the restaurants are full, and again, the basic protective measures are no longer being taken. And I think the trend really started after the war. People kind of stopped wearing their masks and keeping social distance. But you can't do that and not be vaccinated at the same time, because you're just constantly going to be in this loop of infections and deaths and enormous strain on the healthcare system and on the state. So the government, realizing that there's significant resistance to vaccination, has been taking more stringent measures to almost forcing vaccination on people. For example, last week, all governmental employees were mandated, they were ordered to be vaccinated. And the pace of vaccination has really picked up. Also, as travel becomes more commonplace and flights to various countries are now coming back online, you have to be vaccinated in order for you to be able to travel anywhere outside of Armenia. And soon enough, I'm sure Armenia will adopt the same standards, and folks coming to Armenia will have to have vaccinations as well. After the war, a lot of this humanitarian aid, especially aid that's connected with the healthcare field, and also aid for refugees, internally displaced people, has continued flowing in. So humanitarian efforts and humanitarian undertakings by the diaspora, while not at the levels that they were at during the war, continue. and we still are engaged in helping get those getting the humanitarian aid out of Armenian customs. Now, since the war came to a conclusion, the process again has slowed down, and we are facing problems with customs that are technical and not really, I don't see them being justified, but Armenia is what it is. And while we're trying to change the process, things have to come out of customs and the recipients have to take possession of the aid. So the best way, my recommendation is the best way to make sure that we avoid any pitfalls in getting humanitarian aid to Armenia is my recommendation of getting in touch with our office. We have several staff members who exclusively deal with humanitarian aid, and they will usher the process in such a way where we will most likely not have any problems with customs. We'll be able to get things out of customs very fast, or at least, if it's a complicated issue, the problems and the delays will be brought to a minimum. Again, I strongly recommend that you let us know in advance so that we can structure the process in such a way that we don't have to deal with the customs when the goods arrive in Armenia. As far as political situation, Larry, there are elections, extraordinary elections that are meant to happen on June 20th. I think most political forces are in campaign mode right now. When the war was over and obviously things were very unstable, it was my position, regardless of what anyone said, that we need to go to special elections, because the mandate that was given to the government in December of 2018 simply no longer existed, and we needed to determine what that mandate was, what the people of Armenia want, and how they want to move forward. So fortunately, after some back and forth, the political forces have agreed to hold these elections. Whatever one may think about the Armenian government, it did hold the only democratic election since 1991 in Armenia. And the prime minister and the government will make its best effort to make sure that these elections are just as free and fair and truly express the will and desire of the Armenian people. We need this very badly. We need this because we need stability at this point. We need to be able to concentrate on the most immediate national security issues, the border issues, especially Artsakh and Syunik borders with Azerbaijan. As a result of the war, now we have an extra 500 kilometers of border with Azeris, 500 extra kilometers of border that needs to be manned and defended. It's no small task. It's very difficult. We can do it, but we just need to join forces, everyone do their part in their own way, right? Because different people can contribute in different ways, and make sure that the border protection issue is at least handled for the time being, because without that, it's hard to think about stability in Armenia.
There was one specific issue that you've clarified very well. When someone makes a large contribution of medical supplies or equipment, some have heard that there is a 20% tax that the Armenian government will place on that. Could you clarify that for us so we all can work with the ministry to make sure that we're not charged that?
So if the shipment is structured properly, meaning it is nonprofit to nonprofit, you avoid this tax that you're referring to. It's an added value tax, which morally and legally should not be applied to anything that's humanitarian. So therefore, again, one of the goals of starting the process correctly from the very beginning is in order to avoid having to pay a customs duty on humanitarian aid, because every cent that you pay in addition to the expense associated with the aid is a cent that can be used on additional aid or on additional efforts. So therefore, it makes no sense to be wasting money paying taxes for something that, again, morally shouldn't be taxed in the first place.
How do you view the diaspora response to all the challenges Armenia has faced? And moving forward, do you anticipate any changes in how the response should be orchestrated?
Yes, the diasporan involvement, even before the war, we can start with the COVID stage of our recent history, was quite significant. In those early days of March, when every country was shutting down and everyone was short on PPEs, for example, including Armenia, but countries like US were having difficulty with sufficient supplies of PPEs. For example, we were able to secure a 1 ton of such supplies from healthcare professionals in Los Angeles. So while our own compatriots in the US needed these supplies, the diaspora somehow put together a ton of these goods and sent them over to Yerevan, which at the time was a significant booster for the health ministry. And this process continued. We purchased, for example, an entire plane load of PPEs was purchased in China by the Armenian government through, I want to say, World Bank or one of the international organizations, by funds that were raised in the diaspora specifically for that purpose. Of course, during the war, as you said, the war had demonstrated how ill-prepared Armenia was in general for such a catastrophe, for such for an undertaking of that scale. But diaspora stepped up on multiple levels, whether it was through medical aid, professional aid in terms of medical professionals coming to Armenia and actually being in Stepanakert, being in Goris, and providing firsthand medical care to our wounded soldiers. Could we have done better? Could the diaspora have done better? Sure. But again, there were many, many objective factors that prevented it from being much better than what it was. A lot of it has to deal with Armenia itself. I remember in the first 10 days of the war, there were maybe 6 or 7 varying lists circulating in the diaspora in terms of what it is the government needs. The health ministry had its own, defense ministry had its own, the Ministry of Emergency Situations had its own, the Ministry of Social Security had its own list, the Artsakh government had several of their own lists. And as a result, you had a degree of disorganization in terms of the aid that was being accumulated and sent to Armenia. I think eventually that disorganization was overcome. And again, had Armenia been better prepared in terms of what it is, in predicting what their needs were going to be, the diaspora response would have been more productive as well. But we had what we had. What we need, I think, in the future is to plan in advance, so engage in some strategic planning with respect to every aspect of a major calamity like war or an earthquake, so that we're not running around at the end, when it actually happens, and trying to figure out how to deal with the situation. That's one thing we have been very bad at. As people, we don't seem to be able to plan strategically for things, and we need to overcome this, because given where we are, given who our neighbors are, given the geographic kind of the tectonic relief that Armenia is situated on, the plates that are under Armenia, we are going to have catastrophes happen once in a while, and it's just a matter of how well prepared we are for it and how we're going to handle it. And we can't afford to be on the losing end of these situations.
It was definitely a time for learning. Zara, thank you so much for sharing your evening with us. And I'm glad you arrived in LA safe. And anytime you're in New York, please don't hesitate to call. During this conversation, we're so glad to have Dr. Melikian with us. I'll introduce him for those of you that don't know him. Dr. Malikian is a board certified infectious disease specialist as well as an internist. He's the Director of Infectious Disease at the FASI Medical Group in Los Angeles, a principal investigator on many clinical studies. He's a regional medical director for the AIDS Healthcare Foundation. And interestingly, he's more than just a physician. He has a master's in biostatistics from Yale. So he knows how to parse through the numbers. Also, something special about George, he went to Armenia during the war, working alongside patients that had COVID-19, as well as spending time with the soldiers and helping deal with the infectious aftermath of their serious injuries. And George, not deterred by the pandemic, traveled again and came back on Monday from Armenia and is still standing. George, thank you so much for joining us this evening.
Pleasure to be here. Yes, correct. So I went in October for the first round. Both at that time was at the COVID hospital and the military, where hospitals where the soldiers were being brought in. And I just came back. I was there for about 10 days. I was there the last 10 days. I went back because of the third wave that's been going on of COVID that's going on in Armenia to help out.
As an epidemiologist, as a infectious disease specialist, what can you tell us about the Sputnik vaccine? Because I haven't read too much about it.
So the Sputnik vaccine uses an adenovirus vector, and it's probably pretty much the same as what the J&J vaccine does. You say you don't know, we don't know a whole lot. I think it's kind of universal. The data, the Sputnik vaccine data claims that it's 97% efficacy with COVID. They haven't parsed out the strains, but beyond that, there isn't a whole lot of data. It really hasn't been what's the word? Subject to the rigors of academic medicine, the way in the literature, the way Moderna and Pfizer has. In Armenia, I don't know if Zara discussed this. The Sputnik vaccine is available. What they're doing now, by the way, both vaccines are available for free. Younger than 55 and without significant comorbidities, anybody who wants is getting the Sputnik vaccine, and 55 and over. I don't know if you talked about that. Over 55 is getting the AstraZeneca vaccine. Personally, in my opinion, there really isn't that much data on it beyond these. It seems a little bit high. I would say the efficacy 97% seems to me a little bit. It's not very trustable and that's not just me. I think a few of us in the infectious disease community have expressed that kind of concern.
George, here in America, anytime any of us get a vaccine, it's registered and there can be tracking done. And if there's any problems, they can study. In Armenia, is there any record of who's getting a vaccine and which vaccine they're getting?
There is a record. There's definitely a record, and there's registration. I'm not sure about the details though of what the database structure is, how closely these things are monitored. That I don't know. I wasn't involved with the vaccine, any of the vaccines when I was there.
And we hear a lot about the vaccine hesitancy. You were up close and personal and have seen it. How do we overcome that?
Yeah, that's a great question. It's the hesitancy is amazing. When I was in Armenia, when I got to the airport, we were getting our noses swabbed for the COVID, and I was having small talk with a nurse who was swabbing my nose, and she told me herself. She said, isn't the risk of the vaccine almost as bad as the risk for COVID itself, as far as getting sick and dying? I don't want to generalize, but there's a lot of hesitancy over there. And I heard that expressed by a lot of the physicians at the Newark Infectious Disease Hospital that I was there. The background is, I think part of it is, from what was explained to me, that all the way back through Soviet mentality, there's a level of distrust with, what comes down through government as far as this. I talked on TV over there when I was there on CivilNet and tried to answer some of these questions about what the risks are with, for example, with the AstraZeneca vaccine. That, for example, in Europe there were 30 episodes of thromboembolic events out of 5 million doses, according to the WHO. But as far as getting over it, it's the barrier in Armenia. It's very, very difficult. Education, perhaps, obviously, having loved ones, trusted figures, vaccinated. I don't want to come here and sound like I'm bashing Armenia all the time, but the culture is different in a lot of ways. I went to, just as an example, when I was in Armenia, I went to a conference, and it was a large conference, a medical conference. And, we were all in this room, for example, during the intermission, getting food in like one of the halls. There's probably about 150 people there in a small room. Hardly anybody was wearing a mask. I mean, it's a different mentality. I know part of it, maybe a lot more people have had COVID already in the medical community. When I was there last time, we looked at data at one hospital, which I won't name, but something like 85-90% of all the employees there had already had COVID. That was actual data that we looked at.
Regarding the vaccine, this is a question we hear pretty much anytime we get together with a bunch of Armenians. How come Moderna hasn't given a lot of vaccine to Armenia as yet? And the answers historically have been that, Moderna received a lot of government money, U.S. government money, and has contractual obligations and shareholder obligations, and his hands are tied. And that's a fairly realistic answer. George or anyone else, can anyone else share insight into that question? This is asked from one of our members on the call tonight.
I don't have an actual, direct to add to that, other than also I know from other people in the community, from other ID docs in the community, that another issue is concern that with the stability of storage and use of the vaccine, if there is an adverse event that occurs, through for whatever reason, it could absolutely shelf the vaccine, and that's a risk that there's concern about.
Yep. And if I'm correct, the Moderna vaccine can be stored at a regular refrigerator.
Correct.
I have two questions, actually. One is, although I know that after you contract the disease, we don't really know how long your immunity is up there, maybe 6 months, maybe 8 or a year. So given the vast numbers of cases in Armenia, is there a possibility that they're approaching herd immunity? Number one, it seems everybody I know there has had it. So that's one question. And the second question is, George, after you went the first time, I know that there was an effort to standardize the methods in which COVID was treated, and that there were protocols issued by the Ministry of Health. And I know that I think on the first call we had with you after you came back, you discussed the efforts to teach doctors and share information. It wasn't long after that I started hearing that doctors were using varieties of treatment methods, that there was no standardization, and our usual ailment, I will say, an Armenian ailment, that each person had to do it their own way. So can you comment on those two issues, please?
Sure. Hi, Caroline. Nice to see you.
Hi, nice to see you too.
Nice to see you. So yes, absolutely. Well, on the first point, as far as the rate, I mean, they're having a legitimate third wave. So regardless how much herd
Yeah.
immunity there is. It's certainly, not at that level. The issue of immunity to coronavirus, so far, the data does show that there aren't reinfections. There's a recent paper that I'm trying to remember, it was in the Lancet or where, they're talking about something along the lines of 30 cases of confirmed reinfections on planet Earth. As far as the treatment with COVID, so in Armenia, lots of differences this time. So you're correct. After we came back, I think you were on our group. We worked on guidelines together that we had translated to Armenian for COVID treatment and had it sent directly to the Ministry of Health. I can't comment on what every hospital is doing, but I could tell you at the main COVID hospital, the NORC COVID Infectious Disease Hospital where I was very impressed. They're actually doing everything by the book, and now they had remdesivir available now, which they were using. They were using steroids. The more of the issue that, from my impression or from what I saw and what I heard about, and I'll also say this, by the way, the doctors there at the NORC Infectious Disease Hospital, the infectious disease doctors, had exactly the same concerns that we do here. They had installed a new oxygen generator device, a $500,000 device at the NORC hospital in December. So as you recall, this was one of the main issues that we had last time, was getting oxygen to the patients. So that was in place, which was a big deal. There are still some other issues. For example, the piping out of that oxygen was still kind of a work in progress. And the patients were less sick this time than they were in October. Back in October when I was there were people waiting, sleeping on the waiting room floor. And I would say probably every day, probably a good 25% of patients were sitting, desaturated. This time, I would say there was 30% of patients who we rounded on who could probably go home. On a side note, I want to say Dr. Shekardemian put together a group, a very amazing project that we've been working on together at UCLA since, I guess the time when I came back, since the war. And it's a project where we are providing as a pilot study guidance and home oxygen to patients in the hospital who need something like less than 10 liters of nasal cannula. So it's something you can send home on a machine with a portable oxygen generator and free up hospital beds. And that project is going really well. I visited that. They have about 30 patients now enrolled who are out of the hospital being followed, and I just added the NORC hospital when I was there to that project. So these are other ways of helping the process. With Armenia is another thing that's an interesting observation, though. On the other side of this argument is if you look at the cases and deaths curves with COVID in Armenia, you can overlap those curves on top of one another. Usually they're supposed to be, the deaths curves are a little bit right shifted than the cases curves because obviously, there's first you have a wave of cases and then the deaths usually follow on average something like 2 to 3 weeks later. That's what our curves here look like. But Armenia, they're perfectly overlapped, not perfectly, but very well overlapped. And that still suggests that is, it's called a lead time bias. And it means there's a combination of two things, one and or the other, which is late diagnosis and treatment failure. And it's hard to parse, what the contributions of both those factors are to explain that, that phenomenon. But definitely, I think that's what's going on.
We hear so much about herd immunity. We need 70% of the American population, 80%. And how do we measure it? Are we including T-cell immunity? Can you shed some insight into herd immunity, both here and in Armenia?
The idea of what level of immunity is necessary to achieve herd immunity is something that's debated in the literature. I mean, some speculate 90, 95. One of the things that's really come about among those who have been studying the epidemiology of this pandemic is, you may all know about the R0 value. The R0, that's the number of cases, number of secondary cases from every person who is infected. There's another variable, it's called a K variable, that's used in epidemiology, which seems to be a lot more central to COVID than the R. And the K value has to do with, if I could describe it, is how sporadic somebody who is infected, how infectious they are to other people over time. And it turns out it's with COVID, it's very random. About 20% of folks will be highly infectious and 80% will not be. Contrary to what we hear, like, oh, well, COVID is very, everybody who gets it is highly infectious. That's actually not the case. But the 20% who get it who are highly infectious is very unpredictable. And that the word I meant was stochastic. So that's a very important variable to understand, and that is partly the reason why it's so hard to get a handle on. So this random walk that COVID takes. Ultimately, it's a matter of herd immunity, certainly, and I think the slowing that we're seeing in some of these other, and even in Armenia, the fact that the third wave isn't close to what the second wave was, is definitely there's a herd immunity effect going on in the background. There's no question.
Great, thank you. And it's interesting to hear about the K value, and there are a lot of myths out there about this virus, and thanks for debunking some of them this evening. We have a question from someone who was vaccinated. Their first question was, can they still get COVID? And the answer is there are 30 documented cases of reinfection in the world, so highly unlikely. But if this person is concerned that their runny nose and fatigue is COVID, can they still be tested even though they've had the vaccine? And what would be the best test?
Yes, so that's a very good point. If I can, just before I answer that, actually, the issue of runny nose is very important. And that's something I observed in Armenia. COVID, when it first started last year, it was a very dry infection. Actually, we use that as a case definition. If you have a runny nose, it's likely not COVID. That's one of the ways the virus has evolved. And in Armenia, and if you could look in the literature in England, these newer strains are very wet infections, and patients are coming in with runny noses. And this is part of what we see generally also with infectious diseases. They tend to evolve towards being more infectious but less virulent. Now, as far as to answer the second part of the question, the vaccine efficacy, we have to take that number and interpret it in a particular way. So, for example, you'll see that this vaccine, for example, is showing this brand, Moderna, Pfizer, whatever, is showing an efficacy of, let's say, 90% against the COVID strains that are in your community. Now, that doesn't mean you can certainly become infected. The 10% chance or whatever that we're talking about after being vaccinated. However, the risk of getting sick enough to end up in the hospital is zero. It's basically 99% to 100%. This is all from the data from the vaccine trials, which is very important to communicate to people that you may get sick, you may after getting the vaccine, but you're not going to end up in the hospital. Really, the data isn't showing that.
Okay. We have a question from Vaughn Martiroshin, but before Vaughn asks this question, just to follow up, many people I'm hearing in America have been vaccinated, and now they're thinking about traveling to Armenia, which is a high COVID prevalence rate. What's the advice to people going to Armenia who've been vaccinated? Should they go? If they go, should they take extra precautions?
I think if you've been vaccinated, you're okay to go. That's the whole purpose of the vaccine. I went, I'm a young guy, I understand, but you can't just, live the rest of your life in fear. I think if you're vaccinated and they're not worried about anything else as far as traveling there, but as far as risk of getting COVID, we're not, it's safe to go.
Along those lines, there was some literature about healthcare providers who developed very mild to nil symptoms of COVID, who are now becoming long haulers. They're having after effects 3, 6, 9 months later. Is that something that's real that you're seeing in the literature, or is that more anecdotal?
No, it's absolutely real. It's actually developing a name for itself called Postcovid Syndrome. Generally, we're seeing it with the sicker patients, the ones who, spent some time either on the ventilator or had heavy oxygen use because of some, pulmonary scarring. We'll see prolonged use of oxygen. And even in Armenia, I wanted to add, since January, all the patients that we'd enrolled in our outpatient management program that were up to, I was saying, 28, we haven't discharged a single one. They're all still using home oxygen of the ones who have sent home. So the range of symptoms are broad. Most of the time, the most predictable one is long-term or very long-term use of oxygen or a slow wean off oxygen. The other common symptoms are mental fog, fatigue, persistent fevers, and I get consults here from the community in my ID clinic too about patients who are having persistent symptoms.
So then going back, we're vaccinated, 94% protection. We can still get disease. The great news is if we get disease, it'll be mild disease. We're highly unlikely to be admitted and unlikely to die. But we still could get the post-COVID syndrome. So wouldn't that be a pause for concern for even a young, healthy person going to a highly infected area?
No, you won't get the post-COVID syndrome we're seeing with folks who got the infection and lived through it and generally, well, not always, but generally had a harder what's the word, more severe illness coming out of it. But there's no data. There really is no data showing about people who've been vaccinated even getting sick, let alone coming out the other side with post-COVID syndrome.
And that's a constant theme that I'm beginning to hear from so many different people. It's all about education.
Yeah.
And the problem is just so massive, but very smart people are saying, well, in my space, I'm going to educate those people in my space.
Yeah.
And I think if everybody does that and we're all marching to the same tune, maybe we'll overcome.